Hello crystals, welcome back to my channel. In today's video, we will talk about different physiological changes occur during pregnancy. During the 9 months of pregnancy, different body changes are seen in women. So without wasting so much time, let's get started. So during pregnancy, there is a progressive anatomical, physiological and biochemical changes not only in genital organs but also occur in all systems of the body. So about these different changes, let's learn it in detail. So the first is in the genital organs. So which are the changes which occur in genital organs? So the first in the vulva. So the vulva becomes edematous and bluish in color. The labia minora are pigmented and hypertrophied. In the vagina, the vaginal wall becomes hypertrophied. There is an increased blood supply of the venous plexus surrounding the wall, gives it bluish coloration of the mucosa. The pearls can be felt in the vagina. In the uterus, there is a hypertrophy of the uterus take place. Weight of the uterus is normally 35 grams, which becomes 1 kg. Length becomes 35 cm from 6 to 7 cm. Irregular, infrequent, painless contraction as felt at the uterus. In the cervix, it becomes bluish in color and soft. It gets deviated to the left side and get closer to the ureter. So these are the changes occur in the genital organs. Now the second is in the breast. So in the breast there is an increase in the size of the breast. It becomes evident even in the early weeks. It is due to marked hypertrophy and proliferation of the ducts and the alveoli. The vascularity is increased, which results in appearance of bluish veins running under the skin. Nipples become larger, erectile and deeply pigmented. Presence of secondary areola can be seen in the second trimester. Axillary tail becomes enlarged and painful. The next is the cutaneous changes, like which changes occurs in face, um, in the abdomen and in the palm or in the feet. So these changes are first in the face. So in the face there is a pigmentation around cheek, forehead and eyes can be seen. It disappears spontaneously after the delivery. In the abdomen there is a linea nigra, which is a brownish black pigmented area in the midline from xiphis turning to the symphysis pubis. The static albicans means these are the capillaries which appears pinkish before the delivery and then become whitish in colors, mainly found below the umbilicus, thigh and in the breast. We can say it in the other words as a stretch marks. The next is palmar erythema, means it is mainly due to the high estrogen levels, means there is a reddish color in the palm can be seen. Next is weight gain. So the normal weight gain during the pregnancy is around 11 kg. In the first trimester, it is increases up to 1 kg. In the second and in the third trimester, it is increases up to 5 kg. So this weight gain is due to active retention of the sodium, potassium and the chloride ions. Rapid weight gain suggests preeclampsia and need for careful supervision. So the preeclampsia is a condition which is characterized by high blood pressure in the woman whose BP had been normal. Next is body water metabolism. So during the pregnancy, water retained at the term is about 6.5 liter. This retention is due to increased aldosterone level, increase in the renin angiotensin activity, increase in the estrogen and progesterone, and the changes in the osmoregulation. I hope it makes sense to you all. Next is hematological changes and in the calcium metabolism. So in the hematological changes, there is an increase in the blood volume and the plasma volume during the pregnancy. The RBC volume is increased to extent of 20 to 30%. Disproportionate increase in the plasma and RBC volume produce a state of hemodilution. In the calcium metabolism, there is an increase in the demand of calcium up to extent of 28 grams. In the heart and in the circulatory system, so the heart is shifted upward, outward, with the slight rotation to the left due to elevation of the diaphragm. Apex is shifted to the fourth intercostal space about 2.5 cm outside mid clavicular line. Systolic murmur can be heard in the apical or the pulmonary area. Cardiac output is lowest in the sitting or supine position and highest in the knee to chest position. Cardiac output return to normal after 1 hour of delivery. Venous pressure increases leading to pedal edema, varicose veins, piles and DVT means deep vein thrombosis. And in the coagulation system, there is a all coagulation factor increases except the factor of 11 and the 13. Total protein increases but the albumin globulin ratio from 1 gem 7 gem 1 is decreases. In the renal system, so there is a dilatation of the ureter and the renal pelvis occurs. There is a hypertrophy of muscle of the bladder occurs, which are the detrusor muscles, and increased in the frequency of micturition in the early pregnancy. The GFR is increased by 50% of all throughout the pregnancy. It is mainly due to the pressure of the fetus over the urethra. In the nervous system, there is a nausea, vomiting, mental irritability, and the sleeping are the some psychological changes. The depression or the psychosis may be developed in the susceptible individual. In the musculoskeletal system, there is an increased mobility of the pelvis joint along with the increased lumbar lordosis, which produces the backache and the waddling type of gait. So, this is the main reason why in the pregnant woman there is the complaint of lower backache. In the alimentary system, there is a muscle tone and the mobility of the entire GIT are diminished due to the high progesterone levels, atonicity of the gut which leads to constipation. So these are some common complaints and some physiological changes which are seen in the pregnancy. So after seeing this video, we understand that various changes occur during pregnancy. So I wondered how can one woman can manage these things together. Then I asked my mother. She gives me a wonderful reply. She said that mother can bear all this for her child. Motherhood is the most beautiful spirit in the world. Okay, I hope you like my video. Please subscribe to my channel. It really motivates me to make such type of videos. And lastly, hats off to all mothers in the world. Thank you. Stay safe, stay healthy and please keep supporting.